Our sewage could be telling us a whole lot more about the spread of coronavirus, down to the zip code.
A national scale, you can then see exactly where the virus is and where it is not.
Cities from New York to LA are analyzing wastewater to detect COVID hotspots, but we found widespread coordinated testing is still a pipe dream. The country heads into a COVID winter without fully deploying one of the few methods for tracking the virus.
It is frustrating. We're going to see a huge amount of sadness over the next few months. And it's not too late to scale up wastewater surveillance at this time to help us with that.
Early on, scientists realized infected people shed COVID in stool. The federal government began a big effort for analyzing concentration of the virus in community wastewater, with potential to help monitor infection rates as more Americans get vaccinated.
It's something I think from a national level we need to pursue.
But so far it's been up to state and local authorities to launch their own programs, and for some, that's a challenge. We learned New York State, for example, suspended its sewage surveillance pilot after a month, in part because of an equipment shortage. Testing stopped in 4 places, including Albany and Erie County. The university at Buffalo, helping lead the project, tells us they're in the process of acquiring enough materials to continue the monitoring effort moving forward. As with PPE, there is a global shortage of the supplies needed to test wastewater for COVID. Other places are struggling with how to pay for it, with coronavirus aid from Washington running dry.
The biggest factor, the limiting factor is finances.
The result is a patchwork of places analyzing wastewater across the country, mainly big cities and college campuses.
It's not like really a unified strategy, unfortunately.
Professor Colleen Naughton and her team at the University of California, Merced plot testing sites on a map.
When you zoom out, of course, the bubbles are pretty big, so it looks like all the U.S. is covered. When you zoom in a little bit more, you do see it's like a bit more spread out.
BioBot Analytics looks for COVID in wastewater for about 200 cities and counties.
We're at the beginning, let's say that.
And could be doing much more.
There hasn't really been a strong coming together yet around a specific approach or even like standards.
The CDC tells us it's working on it, still building out a national sewage testing database, not available to the public yet.
It is, I think, valuable for the public to see that data and like take action and just use it as another deciding factor of like what activities and what risks I'm going to take.
Possibly life-saving information.
This is the sample itself.
From your own neighborhood. Patrick Terpstra, Newsy, Washington.